Thanks to everyone for checking out Maverick Physical Therapy. My name is Mark Friends, and I'm the owner of Maverick Physical Therapy. Welcome to San Diego. Thought I'd share with you guys a little bit in terms of some questions that you have, perhaps amongst the rehab and the performance enhancement process, and how your story can find connection to that, and how and why you can value what I have to kind of offer. In thinking of that, and when you saw Maverick Physical Therapy, I think it's safe to assume that you already had an assumption potentially as to what physical therapy is, whether you've been through it yourself and or you know someone that's been through it, and you already have this preconceived notion potentially in terms of what this could possibly be, and what you think I do in comparison to others, and your overall view and perspective of maybe physical therapists. So what I would like to challenge you with before we dig any further is to have a very open mind in terms of what you're going to be thinking about what I have to say, and not so much in terms of comparing it to physical therapy in general, but from a rational perspective, from a common sense perspective. I think that we're definitely going to together in this conversation right here really challenge our thoughts in terms of what physical therapy is. And so some of you might be thinking, first of all, well, what is physical therapy? And I would like to return that question with a question and ask, what are your expectations for physical therapy? And I think right now you can push pause if you'd want to, but I think a wide variety of things are going to shoot through your mind. Through these episodes that I'm going to provide and kind of go through, I'm going to talk about things such as what a physical therapist is, the things that define us, what we should be able to do. I'm going to talk about the applied functional sciences, and I'm going to be conversing with you about principles, strategies, and techniques, but also these truths that are our principles, these physical, biological, and behavioral truths that are undeniable truths to that of a human being. So, with regards to physical therapy, a physical therapist today is considered the primary care physician of the musculoskeletal system, meaning we can, should, and need to 100% know how to come up with a rehab diagnosis. And what I mean by that is a tissue-specific impairment in which you, the individual, the patient, the athlete, are coming to me for. And I also need to be able to, more importantly, be able to come up with the root of the problem, cause and effect. Okay, you're there for the effect, but it was caused by something else that is creating the issue. What I'd like you to do amongst this journey is to know that all clinicians, whether it's a physical therapist, whether it's an athletic trainer, a strength and conditioning coach, or along the med school clinicians, a medical doctor, an orthopedic surgeon, a physician assistant, a physical therapist, know that although we take in our respective fields the same national licensure exam, pass our state boards, etc., that not all clinicians are created equal, just like human beings. You are not the same as Bobby and Jimmy and Tommy, nor are they the same as Melissa, Tammy, and Jolene. So with regards to that, we need to know that there's a certain standard that needs to be met to know that patients and individuals like yourself are treated in a very ethical, in an ethical and truthful manner that comes from a loving heart, but also know that the criteria that's set for everyone to go through school is designed for those individuals to pass their national licensure exams. After that, it's up to the individual, the clinician, to take their education, to take their knowledge, to take their skill set to a completely different levels in terms of being the best provider that they can for the individuals that they are helping out. So back to being a physical therapist, and that the first thing that I do, and I need to be able to display to a patient when they come in for an initial evaluation in my own mind and up front to them are, hey, you know what? I need to be able to reproduce your symptoms today and take them away with movement. I need to be able to know if you're within my scope of practice to be able to treat. In my own mind, what that simply means is, hey, differential diagnosis. If from a musculoskeletal, neuromuscular perspective, if it's not making sense with this response I'm getting based on what the nerves are doing, the muscle, the fascia, the all the other forms of connective tissue, ligaments, capsules, tendons, bones, and our big players, the joints, the cartilage. If we're not getting a response that's consistent with the movements that we're taking an individual through, we need to refer that patient, we need to refer you back out as soon as we can to someone else, some other clinician that we collaborate with to get you the best care. So first, right off the bat, are you within my scope of practice to be able to treat? And then I need to be able to perform as a physical therapist is the expert in the movement sciences and biomechanical sequencing throughout the entire kinetic chain force producing system that's linked together from the toes to the fingertips. I need to be able to know what tissue is at fault, and I need to be able to use a variety of best exam findings with movement and special tests to be able to reproduce that stuff so I can pinpoint and put together a plan of care and establish short and long-term goals to be able to specifically customize and treat you and only you. Being a physical therapist, unfortunately, and like that of many clinicians, we know that oftentimes individuals that treat are not treating an individual as an individual, and nor is there customization that is used, but becomes this protocol-like system. So we get this imprisonment of protocol that is favored over the empowerment and the encouragement of the individual, of customization. So we need to be able to, with this rehab diagnosis, go after the root of the problem. We need to know motion. We need to know the three-dimensionality of joint sequencing in multiple joints, multiple segments, multiple combinations of tissue horizontally, rotationally, vertically throughout the chain, so that we can specifically, as these tissue healers, know how our intervention is going to affect the rehabilitation and the restoration process. Does that make sense? So, okay, so we come up with this rehab diagnosis. We come up with the root of the problem. We need to know the stage of the condition in which that tissue is amongst the healing process. We need to be able to have conversation with the individual, with the patient, to find out the chronicity, potentially, thereof. Of great significance to us is finding out, ultimately, the biggest, if we only had time for 3 questions, or 3 or 4 questions, what was your mechanism of injury? Was there an injury involved? That gives us a good, solid kind of direction into what we can approach next. What makes your symptoms worse? And is there a time of day and what makes them better. That right there enables us, empowers us to develop a hypotheses in terms of maybe a few things that could potentially be going on. And although one individual could have lumbar spine stenosis or a herniated disc or a protruding disc in the lumbar spine, for instance, we would not treat everybody the exact same way at all. And so we need to know what caused it and what's making that individual, what will make them more successful, and how are they responding in terms of success and failure. Because as individuals, nobody likes to go to a place to be told how terrible and unsuccessful you are at something, which unfortunately in the rehabilitation field, the strength and conditioning field, we're oftentimes told that, and that's the focus element in terms of treatment thereafter, when in all actuality success drives success, iron sharpens iron. We need to go after and look at where and what dimensions an individual is successful with, so that we can spiral them out of that, given the stage and the condition of healing, the rehab diagnosis, the root of the problem. The physical therapist needs to know the stress-strain curve and loadability better than anybody. We need to know the effects of gravity, momentum, inertia, and ground reaction force pertaining to motion and movement, and how and why that individual got to us the way that they did, and how our intervention therefore is going to be affected by the effects of those laws of physics. So with regards to stress and with regards to strain, stress you can simply think as the kinetic chain, the neuromuscular, the musculoskeletal's ability to develop this internal force and tension to overcome the resistance of gravity, momentum, inertia, and ground reaction force, to eccentrically decelerate those loads, to isometrically stabilize as we transition to unloading and disassociating motion throughout the entire kinetic chain. If we're unable to overcome those loads and the stress becomes too much, we develop strain. The inability to resist deformity from a physiological perspective in tissue, and that's ultimately the end result of not being able to be biomechanically consistent and efficient for the recreational and occupational responsibilities that we're involved in. So ultimately, the physical therapist, the primary care physician of the musculoskeletal system, plays a big, huge role in determining if this individual, if this patient, the patient, the client, is first of all appropriate for service, and being able to use and go after with motion and old school techniques, classical techniques, to determine through best exam findings what is going on with this patient, and is there other clinicians that need to be involved in the most appropriate care for this individual. So